Hi, this is Chris Marty with part two of my series on what it's like to be a telephonic case manager and a life in the day. Last time we spoke a little bit about real life of a case manager, where you can be a case manager like a hospital, remote setting at home, insurance company, clinic, etc. Today, I'm going to do just a quick overview of what kind of criteria that you need to be a case manager, education, a little bit what kind of experience, etc. For criteria to be a telephonic nurse case manager, 99% of the time you do have to have your registered nurse. You don't need to be a BSN, but you can have your 2 year. Most employers these days do want you to have your CCM or your certification. If not, they usually want you to have it within 2 to 3 years of employment. Most places do allow, sometimes reimburse you for that. You usually can't be a case manager right out of nursing school. It benefits you the most if you have a few years of experience. It's important to get, I would say, at least 5-6 years of experience. And I take that using me as an example. I got a job right from the hospital to case management, and the first year was really tough. I made a lot of mistakes. I didn't know exactly what I was doing. You really have to go to your mentor and your trainer a lot the first year. It's a big learning curve. But you have to go back on your experience of home care, bedside nursing, the diagnosis is the chronic illnesses. So the more experience, the better. Because you do have to do a lot of education with chronic illness, authorizing home care, different things like that. So the more background and experience you have, the better you're going to set yourself up for success. The other thing is there's other pieces at insurance companies and stuff that you could look into too. It's not really case management. There's utilization review, appeals, denials, claims, pharmacy, those different things. You kind of work hand in hand with them as a complex case manager as well. Those are different departments that you work with. In the hospital, you also can work with those departments hand in hand, but you don't actually do those positions. I'm going to talk briefly about wage. You can make really good money depending on how many years you've been a nurse. But bedside nursing, you do make a little bit more money. I think I'm getting cut off now because it's been the 3 minutes. Please like and subscribe if you like what you hear.